Sounds good. So we can maybe start with some introductions. Does that sound good, Kevin, for you too?
Yeah.
Cool. All right, I'll start since I'm already talking. So I'm Jackie Crossan. I'm a director of product at Humana, and I lead a team of product managers over there where a lot of our main focus is on delivering virtual care solutions. And so virtual visits, AI triage, asynchronous text, remote monitoring solutions. And so very often we'll leverage ML, AI, and different data analytics to really drive those solutions where we deliver really these products both for Humana-led providers, so for providers under the Humana umbrella, but then also for our network providers to ideally in the end really deliver the best care possible for our members. Prior to Humana, I've been at a couple different tech startups. Previously, right before Humana, worked with Kevin at Clover Health, so it's really fun to be with you again, Kevin, and having this discussion. And before my stint in the startup world, I was at Athena Health for about 4 years, where I helped to stand up their interop product and platform, and really did a lot of work on their API development and standing up their marketplace there. And so that's my brief intro. I'll kick it over to you, Kevin.
Sure. Thanks, Jackie. Good to see you again. So I'm Kevin. I'm Director of Product and Business Intelligence at Clover Health. Clover Health is a Medicare Advantage and Medicare fee-for-service. We operate in the direct contracting business as well. I've been at Clover for the last 2.5 years and lead our product team focused on our core platform called Clover Assistant. Before Clover, I've been in a couple of different roles. I'd founded a digital health startup in the pharmacy space using conversational AI and chatbots to support patients in getting their medications, and then was head of data and artificial intelligence at a digital health company called Augmetics, which provided virtual scribe solutions for a range of PCP specialists and other primary care or other physicians across the country. At Clover, we leverage machine learning quite broadly. Our primary applications are within the core product of Clover Assistant, where we try to use machine learning for a couple of key areas. One is suspect diagnoses and identification of underlying kind of ground truth of medical truth. It's hard to know necessarily from claims data or EHR data whether someone truly does or doesn't necessarily have a condition. So we use our machine learning to help identify what we believe is the true answer between all those different data sources. We also use machine learning a lot in risk stratification to identify those patients that are most at need of medical care and intervention to support that over time. So those are some of the ways that we're leveraging artificial intelligence. I think one of the topics both Jackie and I have spent a lot of time working in, and one of the things that is often a challenge is building machine learning is great. A lot of people can do it, a lot of fun tools, a lot of things make it really easy. The hardest part, especially in healthcare, is access to data. So within the healthcare ecosystems, that often becomes one of the biggest barriers. Like Clover, for instance, Clover Health is now about 8 years old as a company. For the first 5 years was started and continues to run a Medicare Advantage insurance business. Had we not run our own insurance business, we wouldn't have ever built up the data set to get to the scale that we are to be able to apply machine learning at the levels that we are. So the vision for Clover was always to be that technology company, but really needed to start as an insurance business to even get access and scale data in such a way that you can even start building and training machine learning models to get to this scale. Jackie, you've been at a couple of different startups that have gone through some of those things. What was your experience going through some of those?
Yeah, I would say in general too, I think what really I found most appealing about moving to the payer space, frankly, was just the concept of having access to so much data for a variety of reasons, right? ML models and AI being one of them. But I think previously being in the EMR space, right, it's like you're almost always begging for data. You're like, oh, can we please do this integration? Please send me this data. And moving over to Clover, which was my first step in the payer space, it was really cool because you just have all of this data, right? Like you have all of these claims, all of these insights, and you can really leverage to drive care. And so, taking in that claims data, understanding what diagnoses could be relevant, right? And really trying to change that particular treatment plan is pretty exciting. And I think too, for me at Humana now, even a lot of what we're trying to do is stand up that digital front door experience. And so, and an example of how we've leveraged AI recently is when COVID hit, really being able to help our members get the right treatment, right? So if they were experiencing COVID symptoms, what we did is partnered with an innovative company in the marketplace that has this fantastic AI symptom checker to allow members to go through this almost like an interview to assess what symptoms they have without really needing to engage a provider or a care team yet. And then have that recommendation that, hey, it sounds like you might be having COVID. Let me recommend these next steps, and really connecting them to that next step. And the really neat thing in that example is that we also connected that to our testing workflow. And so a member could really go through that experience without having to speak to a nurse or a provider at all, assess that they could potentially have COVID, and then within a couple of clicks, order a test to their house to be tested, which was a pretty neat use case to really see AI in action. And most recently, we've really expanded that to an even broader patient population to make that type of service not just COVID related, but really general symptoms, and available for all of our Medicare patients to see how can we get patients to the right next step without really having to engage care teams quite yet, and also personalize that experience, right? Because we are the payer. And so if we know who this person is, we know these are the types of virtual care solutions that are covered, right? If a virtual visit is a recommended next step, or can we hook in insights to their PCP and like make it really easy for them to call the PCP. And so it's really been fun, I think, to see the different ways that we can leverage AI and connect different clinical workflows to best serve the member.
Yeah, I think at Clover, one of the ones that's been most interesting for us to get to really go in is similar to Jackie, using machine learning to really personalize the experience. I think that's something that everybody who uses machine learning preaches and talks about, and Clover no different in the way that we think about that. One of them really is finding and identifying kind of in the patient population those that are sickest. There are almost every insurer offers special programs and complex care and in-home care and care supportive services that can go and actually guide and help give better care to those patients that truly need it. And a lot of those are based on various rules. You get n number of chronic conditions, and you're on these different programs, you get enrolled. At Clover, we've been able to take that and actually apply risk stratification to that, use our machine learning model. So someone who's really, really, really sick from one thing, but is truly really, really sick and needs the help, based on the machine learning model and the data that we're able to drive, we can actually say, yes, we believe that that person should get concierge care or some other quality healthcare service that otherwise rules-based wouldn't really allow for. And we've been able to scale that up to our entire population very quickly. Yep. So curious, Jackie and I kind of going on, happy to keep going through some of the different use cases and ways that we've seen this, but open it up to a small group here for a little bit of a discussion.
Hey, so this is Chris Ford. I thought I'd introduce myself. So I'm on the agency board, and I've been a mentor for a long time. I work with VMN on the steering committee. In my whole career, I'm a Northeastern grad. I turned my co-op job into a career, which was in the dialysis services industry, which was just coming out of the ground when I was graduating, and actually was coming out of the ground out of the Brigham. So I grew up with a singular disease, if you will, disease state that got coverage by Medicare and then turned into a $28 billion business, if you will, but a big expense for the Medicare program because it's under Medicare. So I've been a student of health insurance, health reimbursement, and I had the opportunity. I ended up being the president of the international division. I went around the world for 9-10 years, setting up dialysis clinics everywhere, China to, Eastern Europe, and other places we never get into. But so I got to see around the world how reimbursement really drives what goes on. And I don't mean that in a capitalistic way, but first and foremost, if someone doesn't pay for it, it isn't going to happen, okay? And as compelling as renal failure is, if no one paid for it, these people died. And the US stepped up and fortunately funded anyone who had kidney failure. So, but over the years, the Medicare programs, been covering this disease and have tried all kinds of different things. But I think the other thing I've observed is I think the health insurers are struggling for survival, I think, in the long term, because they've got the providers that really control what's going on, and they've got all the data and they got the money, but I'm not sure you get the benefit of being able to influence things as much as you can. So I see AI as an opportunity for a necessity, I think, for the insurers to use or to become relevant. And I mean relevant in that they have an impact on care. I would say not just health insurance, I'd call the payers. So in some countries like China, there's no national health insurance scheme and it's private pay, but they're moving towards a basic national health insurance thing. Or then you go to France where they pay very well for almost everything. Or a small country like Taiwan, which is 20 million population, and they have a national health insurance scheme that pays for everything. They don't pay much, but they pay for everything. And their model actually works because they have cost control from the get-go in place. So I just wonder where the insurers look at the utility of AI, and I see it in survival, really. And I'll give you one that someone explained to me, like just in China, just a small example how information and the ability to manipulate that can be huge. So as China looks to go towards this national health insurance scheme, which I think is off the table, it was supposed to go in next year or this year, and I think they've just pushed it off with what's going on. But they have rudimentary data collection in all their hospitals. As archaic as, and medicine in China is, I mean, if you live in the Shanghais of the world or Beijing, there's a municipal kind of insurance program you can get into, but you get into rural areas where there's hundreds of millions of people in some of these places, and it's just basic hospital systems and not really state of the art, but they collect data from all of those hospitals. It may only be basic data. So someone said to me, just imagine, Chris, they've got data on 500 people and what's gone on over a period of time. And it's basic information, but they can pick up a little tidbit of something that really makes a difference on that size of that data set. So I just see AI as for the insurers or the payers, it's either survival in the US model or in like a China model. It's really trying to prevent renal failure before they start to cover it. So the big causes for renal failure are hypertension and diabetes. Diabetes is 50% of all new kidney patients are from diabetes, okay? So they can see that coming before they insure it and try to head it off before they start paying. And my final comment is here in the US, we funded the renal program, but we've spent billions on this, but we haven't done much to prevent the disease. So that's my introduction and overview on that, and I'd be happy to hear what other people say.
I think that from Clover, and I'm sure at Humana and every other insurer applies a lot of that logic, and that's the thought. Like our thesis at Clover is that through Clover Assistant, we can extend the data and information that we have to the practitioners that are at the point of care treating the patients. And what we're doing is leveraging the data that we have access to as the insurer to identify, to your point, you're diabetic, you have hypertension, we can actually see your PTH labs and we can see that you're progressing towards potential renal failure. Can we actually help trigger an intervention and let the PCP know that, hey, this is what's happening. You're in there, you're talking to the patient. Can you actually let us know if this is really the thing? And if it is, it's not just getting the data, because that's great, but the EHR already collects the data. It's how do you then trigger the intervention to run a program? So at Clover, that's what we run through Clover Assistant, is not just getting, yes, the person has whatever condition, but then immediately providing the information about what Clover offers to those members, how to get them the care to go and treat that condition. And Chris, to your point, it's exactly what you're, would hope is it's trying to reduce the cost by preventing overall cost. I think one of the hardest things in the commercial space is that, Medicare and Medicaid works well in any larger payer where you're in the program for a long time. It's great. Most customers in the United States are with their same insurance company for less than 3 years. So if you're commercial pay and I've got aging population, which now at this point between 45 and 55, you're starting to see the development of these chronic conditions starting to onset, there's no economic incentive to stave off the 5-year cost. There is shared at the national level, there is shared in the philosophy, but from an economics perspective, I think that's one of the big places where insurance does struggle. And so Medicare, Medicaid, capitated and value-based programs are great because you actually have that incentive. Like Clover reaps benefit by reducing cost, which everybody wants. That's how we win. Those models work well. And I think that's where insurance is trying to get there.
Yeah.
A question for you guys. My name is Philip Devlin. I work for a company called Health Data Analytics Institute, a predictive analytics company. So you know where this question's coming from. But my question is, how do you make decisions on make versus buy for whether it's your analytics or even the programs that you're talking about putting in place? I'm curious.
Yeah, I think in general, it's really, and this is somewhat of a personal point of view too, but taking a step back and thinking about, is what we're trying to deliver like a differentiated value prop that only we can deliver if we build that as like a homegrown thing? Or for example, is it something that's somewhat commoditized, right? And there's nothing, net new that is really gained by working with another company or a vendor or whatever to provide that particular service. So that's always one thing that I tend to think about in general when thinking about really vending or building things homegrown, whether it's like a product, dedicating time and effort into building, ML models, et cetera, is can we do that in a way that's adding value that somebody externally really can't deliver that same value? That's usually a framework that I tend to leverage, but Kevin, what are your thoughts too?
Yeah, I agree with Jackie. It's where are you going to do it in a differentiated way? And on the machine learning side, a lot of it to me is about, is your model able to outperform in such a way that you couldn't necessarily replicate that performance? So if a vendor is able, machine learning model is either the size of the data you have or better feature engineering, right? Like those are like the boil it all down. That's really where you're going to get somewhere. And so if someone has a novel way that they've been able to identify and actually target their models to be truly better in power, that's one place that can definitely win in a kind of buy versus build decision. The place that I see a lot of vendors trying to be is speed. I think one of the things that, at probably Humana, I know at Clover, we have models and we have systems that can train and build new models relatively quickly. Like Data Robot's an example of a company that's done this and done it extremely well across the ecosystem. At larger companies, those can be really useful for like smaller things, but in the healthcare space, the risk is too high, right? I can't trust that someone who's not a data scientist and machine learning expert to train a model to say, does someone have, someone going to die in 6 months, a mortality model. I can't put that into production unless I can actually verify, understand, run it through, get an area under the curve that makes sense. My, precision recall trade-offs are going to work. So unless you can, like, to me, it's performance. If you've got a thing that truly performs in a novel way and it's something that works, that's where, okay, that's interesting. And again, it's either you've got access to a lot of data that's been able to train the model more accurately so that my data would run effectively on that, or you've done some amazing feature engineering and really found the things that really drive that. So those are the ways, at least within Clover, when we looked at build versus buy for machine learning and models specifically, we typically go.
Right.
Other questions? Anybody else want to give any intros too? We're kind of a small group, so feel free to jump in.
Well, to kind of help out, my name is Mike Crawford. I'm the Director of Marketing and Communications here at Bouvet College of Health Sciences. I've really just been enjoying hearing the conversations throughout the afternoon, and especially regarding the effects of just artificial intelligence, how it's beginning to apply just to a greater scope. I mean, we're looking at healthcare as specifically during the event, but just its evolution and how in the past year it's really driven some change, and looking at different things, not just automation, but the making things easier. My wife works in health insurance world too, and just hearing her downstairs, because we both work remotely, hearing just the applications that are being applied to her field and her role there. And I don't think these conversations, in my sense, would be happening as quickly without the pandemic in a lot of ways. So, it was one of those things where it necessarily exacerbated an issue for a need, especially in the world of telehealth, and hearing these changes and the need for such things, and having personal experience with telehealth because of the pandemic over the year. So, my input is such as, and I'm glad to hear, Chris, as an alumni. And if anyone else here is an alumni, please raise your hand as well. I'm always interested in meeting alumni. Oh, Kevin, awesome. And yes, of course, Jackie, Philip, awesome. As someone who's now been now a Husky now for over a year, I love meeting the alumni as well. So, and hearing us and being part of these great conversations. So I just wanted to input that, and everything I look at is from a marketing standpoint in a view. So whenever I hear challenges, I think of ways that you can change the message and get it in front of the right audience.
Very cool.
Yeah.
Cool. Anyone else?
So I have a question for you. How does a run-of-the-mill patient see, feel, or experience AI now as it's going on? Whether you're in one of the Blues or you're a Humana or whatever, what does it show up in there?
So that's been, oh, sorry.
I was going to say that we've developed an app for people that are on Medicare. It's called healthpicture.com. But so a patient can establish an account, and we'll look through their medical history and display their risks across a spectrum of different things. And in fact, we have a front end for Humana. So we have a relationship with Humana, and Humana offers it to their members as well. So that's one way. I'm sure there are lots of other ways.
Yeah, I was going to say that's one of the things that we've been interested in testing is to test adoption, right? Is it something that members will trust? Is sometimes technology can be almost like an intimidating concept, right? Especially for older patients. And so is it something that they'll be trusting or be fearful of? And that's why we're doing a pilot right now with our Medicare population, working with a company called Buoy, to tee that up as an option within their, like in our case, the My Humana experience, to really see, how often are members going to click that link? How often will they go through that whole experience to assess their symptom? And then what we're going to be doing in the next iteration is being able to tie, this was the recommendation via the AI, bot, or whatever you want to call it. Did that member follow through on what was recommended, right? Can we tie a claim to that experience? So if they were recommended to go to an urgent clinic, can we see that in the claim? Is the diagnosis matching up in terms of what was recommended via AI and then what the patient was diagnosed with? And so that's one of the key things that we're very interested in learning more about, and just trying to see, like, will they try this out, right? Is there that trust? And it's been pretty fun so far, and the data is still coming in. It's very new, this particular pilot, so more to come in terms of what the metrics actually look like. But that's one of the things that we were very curious about, is will this be something that people trust? So more to come.
Making it be invisible to them, Chris. I think, patients may not realize there's AI behind whatever, is giving them information. And I think that's a win. If you follow Palantir, that's one of the big things that they're claiming about their technology.
Yeah, and sometimes Kevin, I remember this at Clover too. Sometimes it was like the way that we'd frame things too to providers. If you, not like you want to lie and not use the word AI, but sometimes it's how you frame it too, so that it maybe feels a little bit less intimidating. Because there can be reactions, I think, sometimes to that concept. And so if you explain what it is, often that overcomes that barrier of, oh, that's really amazing. That sounds awesome. I want to do that, versus just saying, this is what this thing is. So it's very interesting in terms of almost the branding of it and communication of it.
So what's the reception from the physician side on AI? I would suspect they don't like people looking over their shoulder. So I wonder what reaction you've seen there.
Yeah, Kevin, you go. Sorry.
It's a little varied depending on the application of the machine learning. And so, oh, well, we're about to end here, but
And
some
so,
people are okay with it. Some people generally are not a fan. And so it depends on how you present it.